Welcome to NCFH's two-part video series on occupational safety training on COVID-19 for healthcare teams. This series shares tips and strategies to provide support to health centers as they adapt their healthcare delivery services. These videos will demonstrate how health centers have implemented safety practices related to the prevention of COVID-19 transmission in two critical areas, including mobile health clinics and in transportation services. Our first video will showcase how Salud Family Health Centers in Colorado made adaptations to their mobile health unit to ensure the safety of their patients and staff while providing care during the pandemic. While mobile units are a good alternative for a service delivery model for agricultural workers, modifications are necessary due to the confined space, which can pose additional risks from a traditional setting. Let us set the stage by introducing Salud Family Health Center in Colorado. Salud is a federally qualified health center operating 13 health center locations, administrative and training sites, as well as a mobile health unit. They provide medical, dental, pharmacy, and behavioral health care services. Through an interview with Salud's migrant health director, we gathered details on procedures in their mobile health unit and their recent adaptations to their practices. Salud is a 36-foot RV that has been converted into a doctor's office, and they serve the northern Colorado region in farms, dairies, greenhouses, and give free healthcare services to the agricultural workers. For most agricultural workers, the mobile unit is the first face they see. While stationed on work sites, the mobile unit has providers on site in case they need to offer any kind of acute care or any concerns that the agricultural workers would need. In light of COVID, Salud's mobile health team modified and added additional procedures in order to minimize exposure before, during, and after patient visits. Let's learn from the three key areas put in place by Salud to safely operate the mobile health units. The first area involves planning the schedule in advance, such as notifying the growers or owners of mobile health services. Secondly, they focus on providing health education to farm workers and employers. Lastly, safety measures during and after an appointment is vital, such as sanitation, utilizing personal protective equipment, and limiting capacity inside. Let's start with advanced planning. Key to Salud's success is the development of strong relationships with the owners. With this relationship established, they set advanced scheduling up to 3 months ahead. With their schedule set, they are able to provide personal protective equipment and information flyers. Next, Salud stresses the importance of providing health education to farm workers and employers. While the mobile unit visits the farms for services, they provide health education to all the workers and distribute masks and available PPE. They make themselves available to answer any of the questions they may have while educating them on how to keep themselves safe. After educating the agricultural workers, Salud's team continues their services with added safety measures before, during, and after appointments. The staff work in full PPE, whether outside or inside, including wearing masks, gowns, shoe covers, and hair covers. Patients are screened before the appointment by taking their temperature, asking preliminary questions about possible symptoms or exposure, and require masks to be worn at all times during the appointment. If it sounds like the agricultural worker had symptoms or if they have a temperature, then they'll let them know where to get tested for COVID-19. After the screening process, patients come on to the mobile unit one at a time. This allows enough space for the patient to be far enough away while they can take their registration and intake forms. Thereafter, the staff will take the patient's vitals and then have them go back outside the mobile unit to wait for the provider to call them in. Once the provider or staff is done with one patient, all surfaces are wiped down with sanitizing wipes. The staff that is outside is cleaning, the staff that is inside taking patient registration is also cleaning, and the provider is also sanitizing their area to make sure everything's clean before the patient comes on. This cleaning cycle is repeated after every patient. Let's take a look at a walkthrough of Salud's procedures in a demonstration video.
Hi, my name's Deb Salazar, and I am the Migrant Director for Salud Family Health Centers. And we're just going to walk you through how we've reorganized the way we see patients on our mobile unit. So let's begin. As you can see, we have a different setup for the mobile unit before anybody can even get on. We have an MA outside who's registering the patient, and who's actually just asking the COVID questions, and will take their temperature before they can get on the mobile unit. If the patient is fine and doesn't have any symptoms and hasn't been exposed and their temperature is fine, then we'll be able to let them onto the mobile unit.
Hello, I'm going to ask you a few questions before letting you in. In the last 10 days, have you had any of these following symptoms? Diarrhea, abdominal pain, nausea, vomiting, loss of taste or smell, loss of appetite, fever, chills, body aches, headaches, or cough?
No.
Any sneezing, runny nose, sore throat, chest tightness or wheezing or shortness of breath? No. And have you been in contact in the last 10 days with someone who's been diagnosed with coronavirus?
No.
And have you been tested for coronavirus in the last 2 weeks? No. Okay, thank you. So now I'm going to check your temperature. Okay, 98.1, normal. And can I get your name, please?
Mary Smith.
Thank you. All right, so now I'm going to give this to you, and then I'm going to take you inside to get registered.
So as you can see, the MA outside, even though she's outside, she has full PPE. So she has her face shield, her mask, her headpiece, and her gloves, as well as a gown. And that's how she'll stay the whole afternoon or evening. When the patient leaves, she'll wipe everything down to make sure everything's safe for the next patient. So once the patient's done outside, we'll have the patient come in. We'll seat the patient on the other end of the couch, and they'll do the patient registration.
May I have your full name
Mary Smith,
and your date of birth?
June 12, 1996.
Okay. Hello, Mary. I think we need to do the patient registration. If you don't mind, initial and sign up for you.
As you can see, the patient registration person also is in full PPE.
Thank you. And Monte will be with you to do the vitals.
So now the patient will have the vitals done. Again, the MA is in full PPE while taking the vitals. That's to ensure that our staff as well as the patient are safe. Another note, if a patient comes without a mask, we always have mask on hand so that nobody's coming on the mobile unit without one.
Everything looks normal. If you want to come right outside, we're going to have you sit and wait for the medical provider, okay?
So as you can see, the staff will now wipe everything down, and in the middle of the mobile unit we put a partition so that people aren't walking through the mobile unit unnecessarily, and it just keeps everybody safe.
Okay, so then now I'm going to have you take the seat over here until it's your turn to see the provider.
So the patient will be directed to sit in the chair that's in front of the provider door. And so once the provider's ready to see the patient, they can just call to the patient to come back on the mobile unit. So now the MA who's outside will wipe down everything outside again for the next patient. So the patient goes in, back with the provider.
How are you feeling today? Okay.
They have the medical visit, And once they're done, the patient will be directed to come back out the back door.
We're gonna go down through here.
Once the patient is gone, the provider will clean and wipe down the room to be ready for the next patient. As well, the provider has full PPE. They have their mask, their face shield, their head cover, as well as their gown. So this is how we keep everyone safe on the mobile unit. Full PPE, wiping down after each visit, and making sure that all of us are safe. The staff as well as the patients. Thank you.
As we learned from Salud Family Health Center, minimizing exposure in mobile health units is key, and safety precautions are necessary due to the confined space. In summary, these are the critical steps that Salud implemented to their mobile health unit services to minimize COVID exposure. First, plan a schedule in advance. Secondly, provide health education. Lastly, implement safety measures before, during, and after an appointment in the mobile health unit, such as sanitation, utilizing PPE, and limiting capacity inside. Through this video, we hope your health center can take away essential areas to consider for safety precautions for the prevention of COVID-19 transmission. If you'd like to view the companion video on transportation, visit the NCFH site to find the second portion of this series.